Dr. Adeodata Kekitiinwa, known by her peers, workmates, subordinates and colleagues as Dr. Adi, is an accomplished and renowned physician, lecturer and associate professor of pediatrics at Baylor College of Medicine Children Foundation. She was conferred as associate clinical professor of pediatrics in Houston, Texas, United States of America in 2014. A quick snip into her senior management staff will reveal who the real Adi is.
Dr. Adi Kekitiinwa started off as a head of pediatric infectious disease clinic that barely had 500 patients at the time. She grew that clinic to what now has over 8,000 patients in care, creating, I think, the largest pediatric HIV clinic in the world. So we are proud to see that under her leadership, Baylor Uganda has expanded to what it is and to the successes we are known for.
I could say she was the best of the lecturers at what she was doing. And I'm privileged that I got to learn from the best that Uganda has. Dr. Adi is a full package. I am what I am because of Dr. Adi. She has walked the talk, and that is one attribute that I've learned from her. It was a privilege working with you. You have nurtured us into what we are today, and we want to wish you all the best in your next phase of life.
Dr. Adi has been my supervisor for the last 18 years. The ultimate definition of Dr. Adi is what we call integrity. She keeps her word and she does what she says she will do or she will not do. Thank you for being one of the few Ugandans who are able to make sure that things are done in the right way they are supposed to be done.
I've been on the shoulders of a giant who has taught me how to look at things differently and to be a better person. I think her leaving of Baylor Uganda is leaving me in a much better position to execute and work anywhere else, because Baylor Uganda is a training ground. I'm going to miss her. I'm going to miss her because she's someone who knocks on your door anytime, anywhere, any place, and you have to be on top of the game every time she calls on you.
I found Dr. Adi to be one, very energetic. I like saying she runs on energizer batteries, so she never runs out of energy. She's a very professional lady, and what I admire most is that she's very keen on building people and building organizations, and she's also a lady of integrity. Definitely, her work has been of immense value to this country and to the staff of this organization. We wish her a happy retirement as she puts on new shoes.
She stands out. She's an outlier. She stands out from the crowd as a leader. She's very exceptional in terms of energy. Sometimes I think her energy is unmatched. And she's very decisive, very assertive, and yet she has the ability to motivate her team towards success.
Dr. Adi, congratulations upon your retirement. And when I think about you, I think about passion, I think about a teacher, mentorship, I think about children and their safety. And I hope that as you retire, you'll be able to continue to take care of children and continue to pursue your passions.
Dr. Adi, you are an inspiration to me. You're someone who can always be counted on, or at any time of the day, any time of the week. And you've been a great mentor to me, and you've guided me up to the level where I am now. I'm happy. I attribute all the success to your effort. You've been this proverbial mother who beats with the right hand but will not let you fall. In Uganda, what they say, akuba aumba humba.
Dr. Adi is not just what you have just heard. She has several accolades to her name. She's a clinical research leader, CRS, at Baylor Uganda, Impact P1115 investigator of record, site principal investigator for Odyssey trial, co-investigator for Smile trial, site principal investigator D3 trial, to mention but a few. Hers is a story of determination, resilience, tenacity and fortitude to impact the lives of infants and families of all those infected and affected by HIV/AIDS.
Dr. Ade, with just from her head, I saw knowledge flowing out, not from her personal computer, from which she wasn't reading. She sticks to the goal, and no matter what comes along the way, she will remain focused. And that kind of discipline helped us as leaders, in the first place, to copy into her working discipline. Number two, it helped bring cohesion in terms of performance to our district health team.
She is somebody who loves excellency and is so passionate about data. And she has been pushing us as health managers to concentrate on data. When she comes or when she talks to you, she's on point. She points to the areas where you need to improve, and she's very perfect about that.
She's a straightforward lady. She will tell you the truth, and she will not hide, and she will try to guide you. Really, Dr. Adi is a good mentor.
She has made and modeled many of us. She's a renowned researcher. She has several researches which some are complete, some are ongoing.
Other than calling you only a life-saving investor, of course, you've done a lot in terms of teaching. Offering your life to the rest. I think most of the DHOs here, they have passed through your hands.
We can honorably witness and confirm that the purpose for which you were created for has been fulfilled.
My first appreciation goes to the outgoing Director Baylor Uganda for exemplary leadership, dedication, and selfless service you rendered in the period you served in the capacity as Director Baylor Uganda. Congratulations to you, Dr. Adi.
Baylor's communication manager Joseph Basoga caught up with her to briefly recount the story of her unique, excellent service at Baylor Uganda for the last 18 years.
I think my best moment was when we won back the Fort Portal region for the second round. My worst time was when we lost Soroti Horse region. I felt lost. But as a leader, I was able to redeem myself and said, if I feel lost, my entire team will feel lost. And we were able to get up and move on again. Best moment when I entered the clinic, and often it happens, is when I see those children that we started on antiretroviral therapy and they run to give me a hug. Dr. Ade, you may not remember me, but I'm the one who had this big thing on the nose. It's the best time when you know that you have touched someone's life and someone appreciates it. My personal words that I would tell my directors as I leave is remain working as a team, remain focused on doing the right things at the right time, because with projects, you must always be on target. Was the Saving Mothers Giving Life project. Because we were able to reduce maternal mortality in 1 year by close to 40%. I had never seen until COVID the level of teamwork, the level of engagement of districts embracing a program like the Saving Mothers Giving Life. I'd never seen a community embrace a program as Saving Mothers Giving Life. It gave me sleepless nights with the best results.
Indeed, you've heard it yourself from the lips of Dr. Adi. 18 years in service, every day, on point, walking the walk and walking the talk. But I wanted to ask her 5 questions that are one of offered. Your favorite meal?
My favorite meal is matoke with granuts mixed with fish. Luwombo.
Your favorite destination?
New York.
One inspiring doctor in the world that you felt, this pediatric doctor, I wish.
Professor Mark Klein.
Your favorite sport at Baylor?
Standing in the corridor between the training room and the boardroom and looking down to see the patients and seeing how they are being served. That gives me smiles because then I can see the ones that I have not seen for a long time, the children that have grown, seeing the children run around. That gives me pleasure and makes my heart smile.
Thank you so much, Dr. Adi. And in the coming Vox Pops, we are giving staff an opportunity to say one thing that they think that has impacted them about Dr. Adi's life, one thing they admire about her, and one thing that they feel within deep their hearts that she has done to improve their lives.
Dr. Adi is a gem. She's a phenomenal woman. Oh, she's a beauty in many ways. I bless God for the woman, the great woman she created in you. I'm going to miss Dr. Adi.
Why?
She has been such an excellent director.
She lays down her life for others. Whatever she has done, only God to reward her.
She's a great lady with great leadership.
A coach I've never met in life, a pillar, and I always ask her how she does it.
Actually, what she would do was to put on her working gloves, get her hands dirty, and make work proceed. Several times we've seen her stay up late with the proposal writing team just to make sure that it's done well and in time.
She loves hard work. And regarding finances, she's a person who loves integrity.
A super high achiever, and she has a unique personality. She's someone who is after excellence, and once you learn that about Dr. Adi, you love her.
So if you cross roads with her, you will know that she's passionate about kids, she's passionate about work, she's passionate about excellency.
She knows everyone in the organization. Then she also has the heart of the call center.
But she has mentored me silently without even her knowing to become who I am.
She's a very good timekeeper. She's always here very early in the morning, and at her age she's able to come very early. She's able to do all her things on time.
She's a parent. She's have it all what you would have in a good leader.
I was so scared of her because I was seated here, and when she came in, everyone stood up. So the picture I had of her as a scary person, but the years I've worked with her, she's a very good person. She's so loving.
She has done a lot, and all this I don't think we could have achieved without her input and guidance.
There is this common saying that cannot pass each time you have to talk to her, that we are all leaders. It has really inspired most of us that she has worked with.
We've gotten to know each other throughout the years we've worked together. I know who you are, I understand you, and we've created this relationship, like we've become friends.
She's a tough mother, she's a mentor, she's someone who will show you direction where you have to be, where you have to go, how you get there, and she will look at you at the back and see, will you get there?
For me, Dr. Ade is a clear example of a woman who is a go-getter.
She's a lady of principles and standards and SOPs. I know her for SOPs. Every time she asks what's the SOP for this procedure, for that.
It has been a long journey. We're right from the Arrow trial, the first trial in Baylor, Uganda, that has really impacted policy. So I've really learned quite a lot from you. You've always inspired.
She is a teacher, she's a leader, and she has a legacy. Her legacy cannot be denied, really.
You wonder how she almost knows everything about the organization.
And I would like to say bye-bye to you. Thank you once again for leading a wonderful team.
Thank you very much for the support you gave to me. For whatever you have done in my life, I'm no longer the same as a lawyer who joined Baylor 14 years ago.
God bless you everywhere you go. Amen.
I one time drove her, but every, I think 30 kilometers, she would be asking me, Stephen, do you need anything to eat?
Dr. Ade, you are a mother. You've taught us integrity. You've taught us to be resilient.
My best moment, I think, with Dr. Ade was when she boldly recognized our contribution in the program of HIV in Karamoja in a big setting. I felt so emotional.
To me, she's more of a mother. She's someone I met just as a volunteer, and she always encouraged me to do my best.
She has a likeness for numbers and results, and she's an excellent person. She's goal-oriented.
I met Dr. Adi in 1995 when I was 15. She has lots of care. She's so loving, and she's pushed us to be resilient.
She doesn't behave like a boss. You go talking with her in the vehicle, she gives you stories, and she will ask you questions, simple questions, you answer. The more questions you answer, she will know that you are so intelligent on what you are doing and on your job.
She supported our department, the M&E department, to the extent that other departments thought she's favoring the M&E department.
She didn't do lab, but she understands lab with the exact programming that a lab person has. And that's how we have been able to accredit all these labs in the region and become the first region in East Africa, the first mechanism to accredit 100% of the labs.
She was so passionate about the HIV babies. She almost rolled tears, and I really felt deep inside me, there are people who are so passionate about the lives they change. And I saw that in Dr. Adi, and I was moved.
She's the most courageous person I've met ever, and if you ever listen to Dr. Ade, you'll never remain the same.
I have learned how to do my best at any opportunity I'm given. I have learned that from you, and my passion for little children has grown over time. And just knowing that some child out there is going to live a negative life and have a positive life with her mother and her family keeps me going.
For me specifically, she's like a mother. She will ask you for results, and she will actually also ask you how you're doing. How is your family? She is a real mother, a manager, and a leader.
She walks the talk, and she doesn't settle for mediocrity, and that is something I've learned from her over time.
We also asked Dr. Dithan Chiraga, the brain that will succeed Adi, about what he perceives of her.
I want to thank Dr. Ade Kekitiinwa for the great service, for the great work that she has done with Baylor Uganda. On a personal level, I also want to thank her. She was the first person to reach out to me once I had been confirmed as the incoming executive director for Baylor Uganda. She's well regarded, she's well spoken of, but also looking at me who has not been in her space, she's gone that extra mile, she's made that extra effort to make sure that I'm oriented. She's raised the bar, she's raised the organization. It's now a global brand, it's well respected, it has over 500 staff, and it's something that, you know, anybody would really be so proud to take up.
Beyond just opinion, The story of Dr. Adi at Baylor perhaps began in 2003. But how do you tell a story of 18 successful years of a lady at the helm? Let us break it down. Baylor Uganda started as a small clinic operating for 1 day in a week. Baylor under Dr. Adi now boasts of 25 projects, some of which are research-related, 17 active studies, and 7 evaluations. Let's get to the start. In 2003, the U.S. Centers for Disease Control and Prevention (CDC) Uganda office noted that pediatric HIV/AIDS care and treatment services represented a significant gap in Uganda's overall strategy for addressing HIV/AIDS. The CDC Global AIDS Program (GAP) and the University Technical Assistance Program (UTAP) later invited BPI to Uganda to build Uganda's capacity using the experience from elsewhere. This initiative identified with big names in the industry. Professor Philippa Omosoke, then head of the Department of Pediatric and Child Health, asked Dr. Adi, then a senior consultant for the Area Ward, where over 50% of the children admitted were born with HIV, to take over the Pediatric Infectious Diseases Clinic Management at the Child Center. The clinic that later became Baylor Uganda started to realize success and hence what we see today.
As you all know, we also have other homes that have sprouted from this big home. We have a home here in Bujumbura, which is our regional office in Hoima. We have several homes that are part of this office in Kakumiro, Masindi, and at the district in Hoima. Then we have another home in Renzori, where we've been for the last 12 years. We have another home in Mbale, where we've been for 1 year now. So we are proud.
In 2006, with support from BPI, Baylor Uganda under Dr. Adi registered to become an NGO. Dr. Adi has worked tooth and nail to build Baylor from an organization worth $640,000 to now 40 million. Born on 3rd September 1957 to Mr. RUKYALEKERE, the young Adeodata attended Maryhill and Mount St. Mary's College Namagunga before she joined Makerere University Medical School, where she pursued a degree in human medicine and surgery, later graduating with a Bachelor in Medicine and Bachelor of Surgery in 1982. 2 years later, she went back to the famous Makerere University Medical School, where she studied a Masters of Medicine, specializing in pediatrics and child health from 1984 to 1997. She fervently appreciates many people who have left a mark on her life and inspired her to achieve. First, Mr. Mike Mizwa, who has served as board chair for so long, and many others.
To my board, first I want to thank them for good governance, keeping oversight onto our programs, making sure that we do the right things and are able to correct us timely. And to the people out there that we have worked with, the health workers, my district stakeholders, they have been wonderful, without whom we'd never achieve anything. Yes, I want to thank the Ministry of Health because they trust me as an individual and hence trusted Baylor Uganda and have seen the kind of work, and we have become the household name for pediatric and adolescent HIV services in this country. We've led the way and others have followed. We have influenced policy, and to me that gave the ministry with its leadership to trust us. And it is not surprising that the ministry put out my name to the president, who knows me by my first name, to even give me a medal as one of the best serving health workers in this country. This commitment needed a lot of understanding from my husband and from my children. And I want to thank them for accepting me and really embracing as they appreciated the outcome of my work. People, once they know it's Baylor, they embrace us because they know we do not have anything less than excellence and quality in whatever we put our hands on to do. If I had the dollars, I would take a world tour and go and, first relax, calm down, go out with friends, visit countries where my friends are, have fun, and look back and reprogram my life.